Hello and welcome to Global Matters, a program that brings to you global issues that shape the world, issues of international and global agenda that determine our national and common interest. My name is Tunde Alabi. Thank you for taking your time to watch and join us on the program today. And thank God, it's Friday. Today, we will look at COVID-19 and the controversies surrounding the administration of COVID-19 vaccines, both US, UK, Chinese, and the Russian-made vaccine. It was surprising that in less than a year after the outbreak of COVID-19 pandemic, vaccines have been deployed and administered as the virus claimed lives, with more deaths in the US, in the UK, and Europe. By now, pharmaceutical companies, the United States pledged to develop vaccines before the end of last year with a commitment that the vaccine will be based on large, high-quality clinical trials with strict guidance from regulatory agencies like the Food and Drug Administration. But just when the global search for vaccine eventually paid off, with Pfizer, Moderna, AstraZeneca, and others releasing doses of vaccines, controversies and conspiracy theories began to emerge in the form of viral video clips, with Nigerians being reminded of the failed Pfizer clinical trial that killed 11 children in northern Nigeria, an alleged sinister plot to reduce global population. In the midst of the controversies and conspiracy theories surrounding COVID-19 vaccines, a new variant of the virus emerged from the United Kingdom. The new variant is said to spread faster and could be deadlier. In fact, this new variant of COVID-19 is said to have arrived Africa, although it appears Africa managed the first wave of COVID-19 very well, as the death toll from the virus was below what was predicted. Producers of COVID-19 vaccines quickly assured the world that their vaccines can deal with the new variant. However, many countries, especially in Africa, including Nigeria, neither have huge budgets to procure these Western developed vaccines, nor have they developed their own capacity to make own vaccines. There are concerns that substandard vaccines far below what they have in Europe and the US, or even in China, may be sent to Africa. Now the question is, how should Africa weather this second wave of COVID-19 with the variants and the fears of fake and substandard vaccine? What are the challenges to exploring African treatment and prevention of COVID-19? How can African government build public trust in order to attain the needed herd immunity that prevents further spread of the virus? Should people be concerned? How should I be concerned? My family members, my friends, should we be concerned, Nigerians, Africans, about the hasty release of the COVID-19 vaccines? Why is Africa yet to develop a globally acceptable medication for COVID-19, not even malaria or even any disease or virus? There are some elements of truth in Western beliefs that nothing good can come out of Africa despite the abundance of natural and herbal resources deposited in our continent. These are the issues we will explore on the program today. Joining me to look at these issues are Professor Oyewale Tomori, a world-acclaimed virologist based here in Nigeria, and a UK-based ENT surgeon consultant, Dr. Anthony Olorotoba Owa, joining us from London. We hope at the end of the discussion, we will have provoked someone in Africa and Nigeria to start the immediate clinical trial of African-based vaccines. But before I go to my guests, let's take this break and I'll be back. Don't go away. All right, thank you for taking your time to join us on the program today. I have joining me from Lagos, Professor Oyewale Tomori, a global award virologist, well-known around the world, and also Dr. Anthony Oloruntobawa, who is based in the United Kingdom, and ENT surgeon consultant, to joining me to look at the issue of COVID-19, its variants and affairs of the vaccines around and possible substandard vaccine being deployed to Africa, or in fact, or indeed Nigeria. But let me start with Dr. Anthony. Dr. Anthony in London. Doctor, this second wave of COVID-19 with its variants, purportedly to have emerged from the UK, seems to be taking a deadly dimension in the UK, also in Europe and lately in the United States. Should we have a reason to be concerned in Africa? Well, let me limit this to Nigeria. Should we have a reason to be concerned in Nigeria? Should we?
You do, because whilst I don't think it, I think the second wave is actually a general wave, because it's not necessarily suppressed all over the world.
Yeah.
In pandemics in general, we come in 3 waves. So the second wave is usually the worst, and it's anticipated. The reason why I said Africa and Nigeria needs to be concerned is because we do need to prepare our populace for the potential of this taking a nasty turn in order to reduce the effects. Already one is beginning to see, because I was in Nigeria over the Christmas period, and one could see that there were a lot of issues that remained unresolved, public and government inertia to the pandemic, having had less mortality and morbidity from the first wave, had set in. So people were ignoring guidelines that have been put, well-intentioned guidelines that have been put in by the authorities to try and prevent a second wave or actually reduce the severity. I can't hear.
What did you say?
I said, what I'm saying is that I was in the country around Christmas, and I could see that people were already ignoring the guidelines that have been put in place by the authorities to try and prevent a second wave, or even reduce the intensity of the second wave. And if we don't take care, our population could be very seriously affected by this second wave and perhaps another wave if we do not prepare for it. So yes, we do need to be concerned
about this. All right. Let me go to Prof. Prof, when COVID-19 first came, the early 2020, there was a fear around the world that Africa was going to become, every street of Africa will see people dropping dead. There was a fear that almost every house somebody would die. There was a fear that, in fact, the entire Africa continent will become a burial ground. But Africa seems to have managed, against the prophecy of doom, COVID very well. What is the secret? Why has Africa risen above the prediction of mass death? And then this has come back to Europe and America, and Africa is managing its own life far beyond what is expected. What is the secret, sir? How have we come to this level? How did we?
Thank you very much, Tunde.
Yes, sir.
I think let's not jump into thinking that Africa has done very well over this issue. It is more of what the virus did not do rather than what Africa did. I think it is important to make a point that there are all sorts of speculations why the prediction did not come true. And at the time when the prediction was made, they were depending on history of diseases in Africa. So history has proven it wrong, but that does not mean that Africa has done something right. I think it is the way, either the environment and a few other issues, which were still other speculations that might be responsible for the non-severity of the epidemic in Africa. In any case, if you're having the number of deaths we are having, whether it's one person dying or not, is still severe. And so while we're saying that the government officials are saying it's killing people in Europe, it's not killing people here, it must be what the government has done. I said that is totally pure wrong conclusion from what it is. It is more of what the virus has not done rather than what our governments have done.
But Prof,
yes, go ahead, sir.
But Prof, let me stay on you. comparatively what is happening in Europe and America, the number of deaths, we saw the number of deaths in Italy, in America, but this was supposed to initially be the situation in Africa. Something must have been responsible for the either by our natural way of life or the weather, the environment. Something actually did not make something happen so badly as predicted.
We're saying the same thing, that there are all we have seen are speculations. Something within the African region made the virus not to behave like it did in Europe. And some of the speculations are the fact that people talk about our weather and our lifestyle. Most of the cases that you find in other parts of the world, in a place where you have congregation of people in air-conditioned room, where people are congregated together and spreading the virus, that is much easier compared to our own environment, where a lot of people are living on the outside. I mean, out there, we are farming, we are in the market, we are open spaces. How many people are in air-conditioned rooms in Africa? These are some of the issues. There's also the speculation that perhaps there will be a virus which is related to COVID, which have been in circulation in Africa before this one came. And studies are being done right now to find out, looking at archival sera, was there any antibodies to a related coronavirus or this type in Africa before that time. These are some of the speculations that are coming on. And then you look at the age problem. You find that most of the cases that are happening in Europe are more in the older people, who have what we call comorbidities. Look at our figures in Africa. The cases that are happening actually occurring more in the younger group from about 25 to about 50 years of age. But the death is occurring more in the older population. So you need to take all that into consideration. It's happening all over Africa. Younger people are getting infection, but they're not dying from the disease. And because we're not seeing deaths, we think that disease is not serious. And remember, when you get all you are doing with your lab test is only showing you those who are sick. There are hundreds, and according to the disease, almost 60 to 80% are asymptomatic. So there are hundreds of Africans carrying the disease around, but they are not dying from it. You are focusing on the death, not on the number of people who are getting sick. And that's the error we are making.
That's the error we are making. Okay, let me go. Dr. Anthony, as it stands now, there are people are concerned with the issue of vaccines. If I've heard people say to me that, look, are you sure when these vaccines arrive Africa, it's going to be the same vaccine that Prime Minister Boris Johnson took in London, or the same vaccine that President Joe Biden took in the US? Are we sure? So there's this concern that Africa may become a dumping ground for substandard and fake vaccines, raising the issue of very negative speculations. Where do we stand? Is Africa likely to get the same quality of vaccine in Europe and in America?
No one's going to send vaccines of poor quality to Africa.
Is that a certainty? Are we really sure of this?
Just give me a minute. No one is going to send a vaccine of poor quality through the official channels, because that would only cause the vaccine to mutate and spread throughout the world over again, and people will go through the same thing. What you do have is unscrupulous people producing fake vaccines and trying to introduce it to the African market. There are about 9 or so vaccines that are being introduced or will be introduced shortly. So it's not just the one vaccine. So you may not necessarily get the one that President Joe Biden took or the one other one, because they are different vaccines from different companies. And what Africa needs to decide to do, if they do pursue the matter of vaccines, is look for the one that is convenient for the environment. Because if you go for the more expensive mRNA vaccines, the Pfizer, BioNTech, and the Moderna, which are more expensive, they're also more difficult to store, and they will not necessarily do well in sub-Saharan Africa because of the historic problems. However, the other ones, the AstraZeneca and the other traditionally made vaccines, are more likely to do well in a hot environment. So those are other considerations to bear in mind if Africa wants to procure the vaccines, which essentially is not necessarily a magic bullet, but is a means of people improving their immunity so they have a better chance of surviving this virus. And I agree with Professor Tomori. We have a youthful population, So whilst the youth may get the viral infection and recover, and people may well think that they have malaria or typhoid whilst they have COVID, the people with comorbidities like diabetes, uncontrolled hypertension, or the elderly and frail may well die of COVID. And if they get tested, they get into the figures. If they don't get tested, they don't get into our figures. So I think it's wrong to just assume because the figures, official figures are low, that we don't necessarily have a problem. The problem is the resources that we have not available for us to be absolutely sure of the picture of what's going on.
All right, Prof.
It's also
go on, Doctor. Finish.
It's
that.
also quite possible that we do have previous exposure from a serum virus that was being released in the community beforehand. But unless you go on a wide-ranging testing of antibodies, which would be very expensive, we won't be able to answer that question immediately. So there are many, many factors. But in terms of the vaccine, I don't think anyone would send substandard vaccines through official channels, because that only causes the virus to mutate and go back into the Western communities that have the vaccines and make those vaccines useless.
The world may eventually pay very huge price should substandard vaccines find their way to Africa or to any part of it, because eventually it will mutate and then go back to wherever, to Europe. As we are a highly mobile people in Africa. All right, thank you, Doc. Prof, let me put this question to you, Prof. Why do we have a problem of developing our own medication in Africa, or of our own vaccine in Africa? Could it actually be some kind of mental defeat that what happens in Europe? The thought that nothing good can come out of Africa. Because it's not really that we cannot get this thing done in Africa, but we have never had a globally acceptable medication for whatever treatment come out of Africa. Why do we have this problem? Is it that Africa cannot, or we are just suffering from either mental slavery, or our leaders are just incompetent to invest in research and development?
Thank you, Tunde. I think it is important, the question that Tony answered, just to also say one thing and say a few things.
Go on, sir.
Even you've been using polio vaccines, you've been using measles vaccines, you've been yellow fever vaccine. All these vaccines have been used in Africa all this while. Nobody brought a bad vaccine to you. Why should they change now when it comes to COVID? I mean, these are simple, reasonable things that people should begin to think of. Why would anybody think of that kind of thing at this time? Secondly, each country has its own regulatory authority. You think NAFDAC will wait there and let the vaccine come in, which is of substandard quality? So what's the NAFDAC there for? Each country has its own regulatory authority. So anything that comes in must go through NAFDAC. So I think all those who are carrying those stupid rumors, I think we need to tell them straight to the point that that is not possible. Look back on history. I have received yellow fever vaccine. Your children must have received polio vaccines. I have received measles vaccines. Are they dead now? So why would anybody come now when it's come to COVID to come and use a bad vaccine?
But Prof, let's stay on that. I mean, Prof, you and I, we are aware what happened in the north with Pfizer vaccine and the death
let me correct
of children.
There's no Pfizer vaccine in the north. It was a drug called Trovan.
Yes,
it was not the vaccine.
Thank you.
Let's be clear.
Yes.
Let's get that information.
I take that.
Thank you very much.
So what happened at that time? People are still concerned.
What happened at that
time?
Are worried. It is your people who are responsible for that. Go and check the history. It was in Washington Post. Go and read.
Do I have
foreigners to get that thing done in Kano? So our own people were responsible, ministry officials. So let's get this thing clear. And let's be clear about people, about this kind of information. Now back to your question. Why is it that Africa is not, why are we not making any progress on that kind of thing? Let me tell you one thing. The problem is not with the talents we have in Africa. It's not with the individual scientists or researcher in Africa. It is the toxic environment we have created for science and research that brings us what we are. This same Tony has left Nigeria, is back in Europe. The things he's able to do over there, he can't do it in Nigeria because his lab will not have electricity. His lab will not have water. These are issues we're talking about. There are Nigerians who are right there in the center of activities, working on excellent things. There was a time when Nigeria was diaspora for a lot of people. Then we let the environment grow toxic. And that's where we are. And we keep complaining that it's people from outside. It's our fault. Our governments will not create that enabling environment for you and I as a scientist. And that's what made people like Tony to go over there so that their brain can drain to work and be nurtured. We have created the environment for ourselves to become the laughing stock of the world. It comes from good governance. It comes from poor leadership. And it comes from you and I, a few of us, not being able to talk boldly to tell our people enough is enough. And when it comes to voting for the right people, some people will take 50 kobo and then go and vote for the wrong person. These are the issues we should be talking about, not the talent that we have. I grew up in this country, and just like Tony, I never left this country for anywhere. I did all my study in my own generation. That environment was excellent for me to become what I am. I can hold my own anywhere in the world. Within Nigeria, it's still the same Nigeria. It's still the same me, but the environment has changed.
Prof,
and has become toxic for development.
Because of our time, I've got less than 2 minutes. Moving forward, what should we do in Africa? No, let's stay on Nigeria. What should Nigeria, the biggest black population, what should they do to begin to provide a platform for others in the world?
Was it Tony you're asking?
No, you, Prof, sir.
Okay, people talk about thinking out of the box. I said, don't even put yourself in the box. We have put ourselves in a box which they created for us, and are telling me to think out of the box. Get out of the box and think. For example, we need a creative thinking. What was it that made people like me in my time become what you have? Because we had good governance. I couldn't have gone to school if not for the free education of Awolowo. Because my father had 13, 14, 15 wives, and there was no way I could have gone to school. What happened to the governance of those days? It comes back to the basic. It's not as they say, it's not rocket science. It is people doing the right thing.
So how should we hold the government accountable to get the right thing done? What is the way forward? What should Nigerians do?
You and I are responsible for our problem. And which government are you going to hold accountable? When you in your own environment, your own environment, you're not accountable yourself. It starts from me. It starts from you. And these same people, two of us, will sit down here. My man from my village will steal money. I will support him because he's from my village.
I'm sorry, Prof.
But if he's coming from that time, I will say it's wrong.
I've run out of time. Thank you so much, Prof. Doc, in one word, way forward for Africa dealing with issues on our soil.
Develop your primary services. We do not have a decent primary healthcare services and cuts across all our industries. If we don't invest in the country cannot be responsive to your needs. And that applies to both the poor, the rich, the wise, and the unwise. If you don't invest in the country shall serve you, and not everyone will have the chance to fly out of the country for care, no matter whether you're great or mighty in public or private sector. And you have seen this with COVID. What COVID-19 has done is expose the frailties of our system, where even those that could have flown out of the country for care cannot do so. And even if they fly out for care, some of them have to go back. So you need to invest in the country regardless.
All right, thank you so much. We've been talking about COVID-19 and, of course, issues around the vaccines. I've been talking with Professor Oyewale Tomori, a global world acclaimed virologist. Prof, thank you so much for your time on the program. I know you're a very busy person. Same thing applies to Dr. Anthony Oloruntoba Owa. Thank you so much, sir. An ENT surgeon based in London and a consultant. Very well appreciated your time with us on the program. I'm sure the authority concerned would have listened to the point especially made by Prof on the need to invest in our healthcare system. Thank you so much, gentlemen. Your points here well appreciated. Thank you, sir. This is how far I can go on the program today. Enjoy the rest of it. Thank God it's weekend anyway. We can all go home and rest. Please stay safe. Bye.
Allahu Akbar, Allah.